This is Pet Life Radio. Let's talk pets.
Welcome to ER Vet on Pet Life Radio. I'm your host, Dr. Justine Lee, and I'm an emergency critical care veterinary specialist and toxicologist. Thanks for joining us today. Today, we're going to be talking about a really important disease that's up and coming. It's dilated cardiomyopathy in golden retrievers, which is linked to grain-free foods. We'll be right back after these messages. As a veterinarian, I know that whenever my dog goes swimming, he's going to get an ear infection. Well, did you know that one of the top causes for veterinary visits are ear infections? Help prevent them in your pet with a natural product from PetStar Kids 2. Their premium pet ear cleaner just requires a few drops once a week to help your furry kid. Better yet, a portion of your purchase helps save pets with cancer. PetStar Kids 2 is trying to save 100 pets by 2020. Snap a picture of the bottle with your pet, email it to them, and you'll even see a picture of the pet that you're helping save from your sale. Check them out at PetstarKids2.com and enter code PET15 for 15% off.
Let's Talk Pets on PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. Today, we're going to be talking about a really important disease, especially important if you're feeding your dog a grain-free diet or if you have a golden retriever. Now, most of the time when I see a dog in congestive heart failure in the emergency room, it's typically due to a disease called chronic valvular heart disease, or what we abbreviate CVHD. And this is usually seen in smaller dogs like Cavalier King Charles Spaniels, miniature poodles, and other small breeds of dogs. With this type of disease, the valves of the heart are too leaky. And so when I actually use my stethoscope to listen to your dog's heart, I'll hear an abnormal heart murmur. So instead of being a clear, crisp beat, 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 it's more of a whoosh, whoosh, whoosh. This does need to be worked up and treated. And so I typically will recommend doing chest x-rays, an electrocardiogram, and even an ultrasound of the heart, which is called an echocardiogram. It's actually estimated that about 10 to 15% of dogs out there are going to develop some type of heart disease. And again, this is probably one of the top 10 emergencies that I see at the ER vet. More recently, there's a disease that's been actually linked with dilated cardiomyopathy, or what we often call DCM. Now, DCM is a very uncommon type of heart disease, but we see it more commonly in certain breeds of dogs. So, the top breed that I actually see DCM in is actually the Doberman Pinscher. But we can also see it in giant breed dogs. So sometimes Great Danes, Irish Wolfhounds will rarely get it. Now, about 1 to 2 years ago, there was a cardiologist at the School of Veterinary Medicine at University of California, Davis, that was noticing that there were more and more types of golden retrievers that were presenting for dilated cardiomyopathy. And this is extremely rare because it's not commonly seen in this breed. What exactly is dilated cardiomyopathy? Well, dilated cardiomyopathy is when the heart is too floppy. It becomes really dilated and the myocardium, or the muscle of the heart, doesn't contract well. As a result, it becomes bigger and bigger, and the heart muscle becomes weaker, and that actually results in thinning of the walls. This may actually result in a really flappy balloon-like organ instead of a powerful muscular heart muscle. And as a result, the heart can't pump blood efficiently. This is going to result in blood backing up into the lungs and secondary congestive heart failure. It often results in heart arrhythmias, in other words, abnormal rhythms of the heart. Most of the time when I diagnose dilated cardiomyopathy, it's seen in these large breed dogs, but dilated cardiomyopathy is unusual because it doesn't typically cause a heart murmur. Now, I mentioned before in small breeds of dogs that end up getting chronic valvular heart disease, they almost always have a heart murmur I can hear with my stethoscope. And again, that's because the valves of the heart are leaky. The frustrating thing with dilated cardiomyopathy is your dog could potentially have really severe heart disease, and we can't hear a murmur with our stethoscope. And so it's often a lot harder to be able to detect and pick up on. Unfortunately, DCM results in that heart chamber dilation and the inability for the heart to contract well. And this can result in severe arrhythmias and even sudden death in dogs. Now, back in the 1970s, 80s, and 90s, veterinary cardiologists were seeing dogs and even cats with dilated cardiomyopathy. And what they discovered was that it was oftentimes associated with taurine deficiency. What exactly is taurine? Well, it's an amino acid that pets get from eating meat. And this is one of the reasons why I'm never an advocate for a cat or even a dog being on a vegan or a vegetarian diet. And that's because taurine needs to be ingested in order to supplement the body with amino acid. The good thing is, as soon as scientists discovered this, they adjusted commercial cat foods and dog foods to make sure there was appropriate levels of taurine in the food. And as a result, DCM cats has almost completely disappeared. Well, unfortunately, now we're seeing more and more DCM, and there seems to be a link with grain-free diets. Again, this was first detected by Dr. Josh Stern, who's a cardiologist at UC Davis. What they were seeing was a surge of golden retrievers that were presenting with congestive heart failure and being diagnosed with DCM and taurine deficiency. And when they actually investigated it, a lot of these dogs were on certain diets. What they found with the diets were that they were grain-free and they had their protein supplementation in different forms like legumes or even different types of grains. We'll continue with this really important topic right after these messages from our sponsors.
DGP is an all-natural formula proven to help aging pets with joint and mobility problems. It goes to work quickly, providing vital nutrients to the joints while reversing the effects of age. Some people see results in as little as 7 days. Don't let your dog struggle another day. Call 800-521-0543 or visit dgpforpets.com and enter code ERVET, ERVET for 25% off your first order and free shipping.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. Today, we're talking about a really important topic, the rare risk of developing dilated cardiomyopathy, or DCM, and its association with grain-free diets. Now, there's a publication in the Journal of the American Veterinary Medical Association that states that diet-associated DCM is becoming more and more common. And again, this was discovered in California at UC Davis. There's a couple important things that you have to be aware of. It's not just grain-free diets that are causing it, but it's diets that are what we call boutique exotic diets. So when we see certain types of grain-free diets that have lentils or chickpeas or even exotic types of meats, vegetables, or fruit, we do have to be careful because not all pet food manufacturers have the same level of nutritional expertise, and there may not be the same quality control. I will say that in this study that's being looked at UC Davis, some of the dogs with DCM did have low taurine levels. The important thing to keep in mind, though, is supplementing taurine as an amino acid in addition to your food is not necessarily helpful. That means it may be a multifactorial cause for these golden retrievers that are on a grain-free diet for developing DCM. Perhaps it's taurine deficiency mixed with genetics, mixed with a different nutrient deficiency. The most important thing to know is that you should always talk to your veterinarian or even consult with a veterinary nutritionalist if you're cooking for your dog, you're making a homemade diet, you're feeding a raw diet, or you're feeding a grain-free diet. There are a lot of nutritionists that are out there that do offer consultation services by just going to their website. And you can go to the website acvn.org to find a board-certified veterinary nutritionist who can help make sure that your dog is on the right diet. Again, it's important to reiterate that supplementing taurine by itself with a unique diet doesn't necessarily reduce the risk of dilated cardiomyopathy. So I think the most important thing to know is for the vast majority of dogs out there, we still haven't identified the exact cause of dilated cardiomyopathy when we're seeing it with these dogs being fed a certain diet. That said, if you have a golden retriever or your dog's on a grain-free diet, you're worried that one of the protein sources is from a unique type of protein like legumes or chickpeas, you always want to consult with your veterinarian first, or again, even a board-certified veterinary nutritionalist to make sure we're minimizing the risk of diet-associated DCM. The FDA and a lot of researchers are actually actively studying this so we can try to find out what the cause is so we can save as many dogs as we can. Now, if your dog was just diagnosed with DCM, what should we do? You always want to talk to your vet about measuring a taurine level. It's very easy to do. It's a blood test. Just to warn you, it does take at least a week to get those results back. But it is important because if your dog's on one of these boutique exotic grain-free diets or an unconventional diet like a vegan or vegetarian diet, we want to make sure that your dog does not have taurine deficiency. If your dog is diagnosed with DCM, you definitely want to have an ultrasound of your dog's heart. And you want to do this with a board-certified veterinary cardiologist. If you live in the California area, please know there's an active research study going on at UC Davis that's going to investigate this. The important thing to know is you want to monitor your dog if they're on one of these boutique exotic grain-free diets for any signs of heart disease. If they are slowing down, they're coughing, they're not able to exercise or run as well, they're fainting. If you notice any shortness of breath, they have blue gums, their respiratory rate is greater than 60 breaths per minute, you want to get your dog to your veterinarian or even an emergency veterinarian immediately. That way we can listen with our stethoscope to see if they have a heart murmur or do an electrocardiogram to see if they have an abnormal heart rhythm. We may want to even do chest x-rays to look at the size of the heart, certain blood tests, something called a pro-BNP, and an ultrasound of the heart, which is the best way to diagnose DCM. Make sure you're telling your veterinarian what you're feeding your dog and actually bring in the bag or take a picture of the bag and all the supplements and medications that your dog may be on. You can always schedule an appointment with a cardiologist if you're worried, and there should be one in your area. When in doubt, talk to your vet about having a veterinary cardiologist go to your vet's clinic to do the ultrasound. Just to warn you, it's about $400 to $600 for that initial ultrasound, and that's not including blood work and x-rays. But if you have a golden retriever and you're feeding one of these boutique exotic grain-free diets, it's worth doing, in my opinion. Now, we haven't seen this diet-associated DCM in cats. And I will say, thankfully, this disease has almost been eradicated in cats due to taurine supplementation. However, if your cat's on a vegetarian, vegan, or homemade diet, it's worth consulting with a veterinary nutritionalist or even a veterinary cardiologist. Most importantly, please be aware celiac disease or gluten intolerance is extremely rare in veterinary medicine. The only time I've ever seen it is from inherited disease in Irish setters. So again, the takeaway is the majority of dogs and cats don't need to be on a grain-free diet. In fact, I'm actually a little concerned about feeding these boutique exotic grain-free diets because we still haven't identified what the risk of dilated cardiomyopathy is. When in doubt, just because you're buying a more expensive boutique diet doesn't necessarily mean that it's a better diet. When in doubt, I know that picking a pet food is confusing. Please talk to your veterinarian or consult with a veterinary nutritionalist to find out what's the best diet for your pet. Well, that brings me to the end of today's show. Find me at drjustinelee.com, on Facebook at Dr. Justine Lee, or email me your pet questions at drjustine@petliferadio.com. With that, we're out of time, and we want to thank Mark Winter, our producer, for making this show possible. See you at the next episode.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.